Well, news right now, making pregnancy safer for vulnerable mothers. A new Tennessee law could expand access to doula services for expectant moms. Advocates say this could save lives during childbirth for a large part of the population. Earlier this year, the Center for Disease Control reported Black women are 2.5 times more likely to die from pregnancy than white women. Our Jay Shakur spoke to a local doula. So Jay, how does this non-traditional form of childbirth change outcomes?
That's right. A doula provides non-medical birth services supporting parents emotionally and educationally and physically during labor. However, their clients often have to pay out of pocket. Doulas I spoke to say in order for expecting parents, particularly parents of color, to have more healthier birthing experiences, increasing access to those who can't afford their services must become a priority for those in the medical profession.
Expectant mothers in Tennessee are a step closer to having insurance providers cover doula services.
Right now, coverage where I live is almost not a thing. Like we don't have any coverage. Like they have to pay out of pocket.
A newly passed state law expanding access to doula services for low-income Tennesseans, sponsored by State Senator London Lamar, took effect July 1st. It establishes a doula services advisory committee within TennCare. Chanel Bowens is the executive director of Naturally Nurtured Birthing Services. She says it's a step she hopes lessens pregnancy-related deaths and expands access to the nutritional and physical education she and others provide.
We're in a city with a high rate of maternal mortality. So I think it's important to keep in mind that just in 2020, our rate was, I believe it was almost 50 deaths per 100,000 live births, which is more than twice the national average. Having this as an option for people who are seeking to have our support could definitely change what those numbers look like.
According to a study by the Tennessee Department of Health, between 2017 and 2020, about 89% of pregnancy-related deaths were preventable. This committee will advise the Tennessee Department of Health on standards for the profession and recommend reimbursement rates for mothers covered by TennCare. For doula Kimathi Coleman, the potential increased access is long overdue. She just hopes it's administered consistently and fairly.
Where I have to come from the place where I am, which is being an African American woman. As long as it's being executed intentionally, resourcefully, strategically, and inclusively, then I think that it can be a great thing. But all of those things have to be met first.
Now, the TennCare Advisory Committee will consist of 5 team members. It would include the state's Commissioner of Health or someone with experience in maternal health, the Director of TennCare or someone they appoint, and 3 doulas.